Hello everybody, my name is Karen Alvarez and I am a rising senior at Winston-Salem State University pursuing a Bachelor's of Science in Clinical Laboratory Science. So for this learning unit, I will be teaching you how to perform the hemoglobin A1C test on the DCA Vantage Analyzer. It is important for you to know about this test because it helps healthcare workers and diabetics know if the recommended treatment is successfully working or it needs adjustment. Therefore, my main goal for this learning unit is for you to be able to perform the hemoglobin A1C test with minimal mistakes and for you to also gain basic knowledge about the hemoglobin A1C test, like knowing normal reference ranges and so on. So the learning objectives for this unit are: after the PowerPoint lecture presentation, the student will be able to 1. Describe the purpose of the hemoglobin A1C test. 2. Identify normal and abnormal test results. 3. Explain the clinical significance of an abnormal test result. 4. Operate the DCA Vantage Analyzer. And finally, perform a hemoglobin A1C test on the DCA Vantage Analyzer. So how will you be able to reach all these goals and objectives? I have prepared for you a brief PowerPoint lecture presentation and provided all materials required so that you are able to perform the hemoglobin A1C test on the DCA Vantage Analyzer. So after you have gained knowledge through the PowerPoint lecture presentation and seen a brief video of the step-by-step test procedure, you will go to the student lab and perform the actual hemoglobin A1C test on the DCA Vantage Analyzer. You may use any notes to assist you throughout this procedure. Through the completion of the student lab activity, you will have already met 2 of the learning objectives of this unit. Those are operate the DCA Vantage Analyzer and perform the hemoglobin A1C test on the DCA Vantage Analyzer. I will assess your learning of this test procedure by directly observing you while you are performing the hemoglobin A1C test. However, before you begin, I will give you a checklist so that you're aware of what I'm observing you on. After you have successfully completed the hemoglobin A1C test on the analyzer, I will give you a short 4-answer question quiz. Once you have completed the short answer quiz, you will have met the 3 remaining learning objectives of this unit, which are: describe the purpose of the hemoglobin A1C test, identify normal and abnormal test results, and explaining the clinical significance of an abnormal test result. So now that you know about the goals, learning objectives, learning activity, and how I will assess you through this process, I will end this video with some stats about diabetes. According to the Centers for Disease Control and Prevention, in 2014 there was 29.1 million people with diabetes in the U.S. However, only 21 million people with diabetes were diagnosed, and the remaining 8.1 million people with diabetes were left undiagnosed. The hemoglobin A1C test is important in the lab because it can screen and or diagnose diabetes and prediabetes in adults. It can also monitor the average amount of glucose levels in the blood over the last 2 to 3 months. But most importantly, it helps healthcare workers and diabetics know if the recommended treatment for their diabetes is successfully working or if it needs adjustment. So with that being said, the goals, objectives, and learning activities for this unit are very important because it will guide you through the process of learning the step-by-step procedure, and you will gain basic knowledge about the hemoglobin A1C test. As clinical laboratorians, we are a huge asset in patient care, diagnosis, and treatment. And that concludes my video on how to perform a hemoglobin A1C test on the DCA Vantage Analyzer. Thank you for watching, and I hope you've learned something new.